Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Right. In the Wermer syndrome, we have less common manifestations of Wermer syndrome. So, in the Wermer syndrome, the less common manifestations of Wermer syndrome include here the patient will develop bronchial or thymic carcinoids. Okay. Less common features are here the patient develops bronchial and thymic carcinoids. The patient will have adrenocortical tumors. Subcutaneous or visceral lipomas can be seen with facial cutaneous angiofibromas and collagenomas are less common manifestations of MEN1 or Wermer's syndrome. In MEN1 or Wermer's syndrome, it is also an autosomal dominant defect, but here the defect is mainly in the MEN1 gene which is present on the chromosome 11q. Whenever there is a defect in MEN1 gene, this normal MEN1 gene will code for the tumor suppressor gene protein called as menin. So this MEN1 gene on chromosome 11 is responsible for MEN1 syndrome.
thank you and thank you for watching.